right. So again, thank you for everyone for joining me tonight. So this webinar tonight is going to focus solely around surgery. So whether you're about to have your surgery, whether you have had your surgery recently and are just after a little bit of guidance. So that's what the focus is going to be around for the presentation for today. So just a little bit of housekeeping for those who haven't really attended a webinar before or just need a little refreshing. So today's webinar is going to go for about 30 to 45 minutes, depends on if I get a little bit of a ramble happening about a certain topic. There will be time for some questions at the end. So when we get to the end, I'll ask if anyone has any questions. Please feel free to add some questions to the chat box as well, because I can go back over that and sort of just see if there's any questions there, just to make sure you're not forgetting if I say something and you want to make sure you remember to ask a question. So you'll have the opportunity to unmute yourself to ask a question at the end if you like. This is being recorded, so I can send out a recording of this to you if you're wanting to watch it back, or if you want a copy of the slides at all. I am more than happy to do that as well. Okay, so I think we might jump in. So my name is Hope and I'm a physiotherapist. I've been a physiotherapist for about 9 years now. And about 2 to 3 years ago, I just went down a rabbit hole for oncology, as the side of oncology for physiotherapy. It's not something we get taught a lot about in the basics of becoming a physiotherapist. So I was really surprised to learn through different research that I was doing at the time for my graduate diploma about the role that I could play to help people who have or have had cancer. So I went on and I did some training through Pink and Steel, who helped train physiotherapists and OTs a bit more about the cancer rehabilitation side of things. And I really found that in my local area, there was really a big gap between what people needed after a cancer diagnosis and the services that were available. Really, there might be a little bit in the public system and a little bit in the private, but there's really not a lot. And especially in my local area as well, there was nothing privately, a little bit publicly, but again, a lot of waiting lists. So in 2020, in May 2020, which people might remember was just as COVID was kicking off, I made the decision to open my own private practice here in southwestern Sydney. And so now I've been open for about 2 and a bit years and slowly growing, which is great, offering a lot of services, not just one-on-one services to the local area, but I'm doing reformer Pilates classes with a local studio. I do my own aerobic step class in the clinic as well. I'm a lymphedema therapist, so I do lymphedema treatment as well. A lot of hands-on with massage, and I love working with scars. So quite a range of services that I provide through my clinic. And I'm very passionate about sharing what I know, sharing my knowledge and educating people like yourself, so that you're not left in the dark and are not surprised by some of the things that might pop up during your cancer journey, whether that's just as you're diagnosed or even years down the track. All right, so I'm just going to pop that chat bar down for a second. Okay, so in summary, this is some of the topics that we're going to be talking about over the next 30 minutes or so. So we're going to talk about some of these surgical terms that you might come across with regards to your surgery in particular. We're going to talk about some of the post-operative complications that you need to make sure that you're aware of. We're going to go through my guide of what I think is really important that you know post-operatively to make sure you're having a nice, smooth recovery. We're going to talk a little bit about cording, okay, or axillary web syndrome. Those two terms are interchangeable. Then we're going to talk a bit about lymphedema. I'm not going to go into too much depth about that because I could do a whole talk on that on its own. Then we're going to talk about scars as well. And then I'm going to talk about shoulder movement and pain. And then there'll be plenty of time for some questions at the end if there's anything sort of within or outside of those topics that you want to have a talk about as well. Okay, so jumping into the surgical terms. So you might be having a lumpectomy or had a lumpectomy, which is a type of breast cancer surgery in which the tumor and a small amount of surrounding tissue called the margin is removed. And so this surgery can be with quite a small incision and quite simple, or it can still be quite a big incision and quite complex. So even though we might think a lumpectomy is a bit more simple than a mastectomy, it still can be quite a complex surgery and complex recovery as well. We then obviously have the next surgery option, which is a mastectomy, and this is the medical term that is used for the surgical removal of one or both breasts. Now, this can be a complete mastectomy, or it can be skin or nipple sparing. So you can be able to keep the skin and the nipple of the breast itself and just have the breast inside removed, or the whole breast needs to be removed depending on whereabouts the cancer is. Then there is the sentinel node biopsy. So this is the surgical approach used to identify and remove the sentinel lymph node to determine if cancer has spread, and if so, how far. So usually during your surgery, some dye will be injected in and around where the tumor is, and they will see where that area drains to, and then they will take that lymph node that is draining that area and see if the cancer has managed to travel to that lymph node. And so depending on those results, you might then need to go on for the next term, which is an axillary clearance. So this is where they will remove several or all of the lymph nodes from the armpit. If possible, or if known beforehand, this might be done all in one surgery, in the very first surgery. However, this might be done through a separate surgery as well. So first surgery is done, then you get the results of your sentinel node biopsy, and then they might have to go back in for a second surgery. All right. Our next terms are, so you might need or want a reconstruction. So this is where the breast is reformed, and this can be done either immediately. So within the very first surgery where you have your mastectomy, you can have an immediate reconstruction done, or it can be a delayed reconstruction that happens a few months down the track once your treatment is done. The type of reconstruction you have does depend on the type of surgery that you've had done. And so your surgeon will definitely talk through with you what your options might be. So if you are electing to have a reconstruction done, then an expander might be used. So this is used after a mastectomy to increase the amount of tissue that the surgeon has to work with when they're recreating or implanting a breast. This may be placed in during the mastectomy, or maybe a second surgery after you've healed and once you've finished your cancer treatment. But usually I do tend to find that this happens in the very first surgery. Now, an expander will go in at a smaller size, and then they will slowly fill that expander until it gets to the size that they're happy with. This process can be quite uncomfortable and feel quite unnatural, is what I've been told by my patients. So for those who are getting an expander done or have an expander in, you might be able to verify here that it can be quite uncomfortable, but hopefully it is short term, hopefully short term. I know some people who've had their surgeries delayed because of COVID multiple times and have their expanders in for longer, but hopefully short term until your treatment is finished, and then you can have your exchange surgery where the implant is then put in, which will be a round flexible silicone shell filled with either saline or silicone. The breast implants can be either placed over the chest muscle or under the chest muscle, and this will be up to your surgeon to decide what they feel is best for you. There is also the option of a flat closure. which is where the total mastectomy is done and we have a flat closure. The entire breast, including the nipple, extra skin, fat, and other tissue in the breast is removed. The remaining skin is tightened and sewn together, so we have just one line and a nice flat closure. And this is, oh, and that's spelt wrong. I need to fix that. And this is becoming more and more popular and being embraced more by women, but it is completely a personal choice. But sometimes the flat closure will happen first, and then the reconstruction can happen later down the track if you so wish. Okay, so now we're going to move on to some possible post-operative complications that I think it's important that you are aware of. I don't like to get people to be too worried about these things, but I do, again, I think knowledge is power. And if you are aware of these possible complications, if they are happening, it's not a big surprise and you know to be on top of it straight away. So number one, of course, with any surgery, there is a risk of infection. So if there's excessive redness, if you've got a fever, if there's pus or it's really hot in the area, an increase in pain all of a sudden, all of these signs are for a possible infection. So make sure, if you can see, depending on what you can see and what bandages there are, if possible, please try to keep an eye on the area and make sure that you can have a bit of a look and a feel. And if you're concerned, always go back and see your surgeon or your GP as soon as possible. Now, there may also be delayed wound healing. So for many reasons, a wound might be slow to heal. If a scab hasn't formed after a week, so if they're doing a dressing change and there's not really a scab and things are still leaking a bit, make sure you seek professional advice. Now, this might even be weeks down the track as well. A wound might start to break down all of a sudden. So make sure if there's a delay in your wound healing that you seek professional advice from your surgeon or your GP straight away, so that they can be making sure that you're doing everything that you can to help this wound heal. I've had some patients who lost quite a bit of blood during the surgery. It was quite a big surgery, lost a lot of blood. So their hemoglobin and iron levels were quite low after the surgery. And this can have a bit of an impact on healing. So I would ask you to consider your nutrition after your surgery to make sure you're getting all the right protein and nutrients in and making sure you've got plenty of iron in your diet as well. Because if you're low on iron, iron is what is in our hemoglobin, which is what our oxygen binds to. All our cells need oxygen, and especially if we are healing. So if you're low on iron, your healing is going to be delayed. So you want to give your body the best chance at healing as good as it can. So make sure you're considering your oral intake as well. Seroma is another term you might come across after your surgery. So a seroma is a buildup of clear fluid inside of the body. So if we're taking a chunk of tissue out, we've now got empty space. Your surgeon will try to fill it in as best they can, make it look as best they can, but sometimes there's just going to be space that your body's going to want to fill with something, and that will usually be fluid. Okay, so this is pretty common after surgery. It's not dangerous unless it gets infected. It can be painful. It can be uncomfortable, and it really depends on how full it gets. So an ultrasound can be done to diagnose whether you have a seroma or not. And if needed, the seroma can be drained. And sometimes it needs to be drained more than once. So if it's a smaller seroma, it's not causing any issues. The body can reabsorb that fluid. It just takes a bit of time. And there is some things you can be doing, like a bit of manual lymphatic drainage massage that can just help get that fluid moving as well. And the last thing that can happen is we can have some wound leakage. So some people might have some drains in after their surgery, and sometimes accidentally or on purpose, these drains come out too early, or sometimes it has nothing to do with that, but wounds can leak. And sometimes this can be normal. However, excessive fluid is abnormal. The color and amount will determine if intervention is needed, if a drain needs to be reinserted again, or if we need to have certain types of dressings. So if your wound is leaking, or if you've got a dressing on and it's consistently saturated, or it's leaking down your chest or anything like that, please make sure you get it seen to as soon as possible. Okay, I know that all sounds a bit bleak, but I think it's important that you're aware of these things. So if it happens after your surgery, which is quite common, it is big surgeries that are involved with this, that you know what to expect and what to do about it. Okay. We are now going to move on to my post-operative guide. So these are things that I think that you should be aware of for your surgery and after your surgery. Okay. So as I mentioned, drains. You may have drains in after your surgery. It is very, very common. As I said, we've got extra space and lots of surgery, lots of fluid around, and we need to get rid of that fluid. So you will have a few drains in maybe, or one drain, depending on your surgery. Now, these may be removed before you leave hospital, or you might go home with them. You might have some little friends coming home with you from the hospital. These may be in for a few days or even a few weeks, depending on how much fluid is draining. And so I find it's good to be prepared for this. If you've got 2 drains and you've got 2 hands and you need to go to the bathroom and you're carrying things around and whatever, having a bag like the one in the picture there that you can sort of sling over your shoulder, pop your drains into, will give you your hands back to use, and you're not having to worry about leaving your drains behind and it pulling on them or accidentally pulling one out, which happens as well. So just being aware, maybe having a little baggie to put your drains in, so when you're walking around the hospital or going to the bathroom, you can pop them into your bag. Now, a surgical bra is very, very important after your surgery for your comfort, for your swelling, for ease of putting on. As you can see from the photo there, they usually zip up at the front. So that's this one here. Okay, zip up at the front, really nice wide straps at the top, really good coverage on the side and comes down quite low, nice and firm with some good compression to help with your swelling that will happen after your surgery. So making sure you've got a really good few bras to wear after surgery is really, I think, is very important. Now, Kmart have some really great cheap, comfortable options, which are completely fine. I myself personally love these. Now, of course, they are a bit more expensive. They're about $105 or so. This is the Prairie Wear bra from Haddenham Healthcare. But these will serve you well for a very, very long time after your surgery. So not just that post-operative phase, but if you've got a bit of breast edema or chest wall edema, this is going to help you rather than some of the cheaper options, because this is a moderate amount of compression, moderate to high amount of compression, so designed to help with swelling after surgery and long after surgery as well. So your surgical bra should be worn for at least 6 weeks after surgery. As I said, some people wear them for a lot longer than that. All right, hopefully you will be seen by a physio before you get discharged from the hospital. It breaks my heart when sometimes this doesn't happen, more than I would like it to. So if you're about to leave hospital and you haven't seen the physio, either ask to see one or plan to see a physio upon your discharge, okay? You should be given some really gentle exercises to be doing that get your shoulder and your arm moving. These should be changed around the 1 to 2 weeks post-operative, because hopefully they will be getting easy and it's time to upgrade. I really like patients to be able to at least reach 90 degrees with their arm out away from their body by the first week or 2. So if you can't do your hair, you're having trouble brushing your teeth, you can't get that arm up away from the body, you really need to go see a physio. Preferably an oncology trained physio, but a physio nonetheless can help you with shoulder exercises, okay? Walking is really important. You've got to get up out of bed and walk around, just short walks around the ward regularly and build up from there. if you're lucky, a nice mean physio like myself will get up and kick you out of bed nice and early, probably the next day after your surgery, and get you walking. It really is one of the best things for you and will get you home quicker. They want you out of hospital quickly at the moment with COVID, so you probably will get kicked out pretty quickly anyway. And it's important that you keep this up even when you get home. Okay, walking around is really important. Don't let people wrap you in bubble wrap and say, oh no, you've just had surgery, and bring everything to you. Be up on your feet and doing as much as you feel comfortable doing throughout the day. Of course, rest is important. It's equal amounts of both. We don't want to rest too much and we don't want to be active too much, and find that happy medium between the two. All right. What else have we got here? Okay, clothing. Loose clothing and clothing that has buttons or not zippers at the front will be the most functional after surgery. Okay, so they're going to be easier for you to get on and off. It's not going to be good trying to get your arm in through tight clothing after your surgery. So button up or zip up is your friend to start off with. Okay, self-care. It might be hard doing usual things like doing your hair. Okay, so consider how you might tackle certain things after your surgery. Some help after your surgery might be needed, especially with more difficult tasks like, washing your hair, drying your hair, doing your hair. Certain things like cooking and cleaning might be a little bit hard to start off with. So having a little bit of a pre-think about how you might tackle some of these tasks after your surgery will help you in the long run. Okay, sleep. It is so important that you try to get comfortable and be able to sleep after your surgery. You will more than likely not be able to sleep on your side or your tummy for a while after your surgery. The key is to use lots of pillows, lots and lots of pillows to support yourself, support your arm, and prop yourself up a little bit. Some people need to sleep in a recliner for a little bit if you're really struggling to lie flat. I've had some women, especially women who have expanders in, feel really, really uncomfortable lying flat in bed. And so just propping yourself up, with a nice big boomerang pillow or lots of pillows and cushions around you, so you're sort of upright on an angle a little bit, will help you be much more comfortable. All right, driving. Now, depending on your surgery, you may not be able to drive for a few weeks. So make sure you get clearance from your GP or your surgeon prior to returning to driving. Now, I've spoken to a few surgeons, and so if you've had an auxiliary clearance done, the standard is about 4 weeks of no driving. The rest of it is sort of dependent on how much you get your arm going after your surgery and how comfortable you feel holding onto that steering wheel afterwards as well. So just be mindful, you might not be able to drive for a bit after your surgery. So consider that when you are thinking about that post-operative period. Okay, so we're going to talk now about cording or axillary web syndrome. So here are some photos of what some of my patients' cords have looked like after their surgery. Okay, so what to look for? You need to be able to have a bit of a look in the mirror probably and a feel under your armpit, but you might be able to see and or feel a web of thick-like, or it can also be thin, of rope-like structures or one structure under the skin of your inner arm, okay, and under your axilla, so up into your armpit. You may not be able to see or feel them, but the sensations of pain and tightness might be there as well. So to an untrained eye and hands, it might be a bit hard to know whether you have cording or not. But if you do feel tightness and pain, especially when moving that arm away from the body, it might be best to get assessed by either your surgeon or, again, an oncology physiotherapist. You may first notice them when you're doing something that involves raising your arm to sort of shoulder level or above your head, okay? You might not feel it when your arm is down by your side. Cording typically occurs anywhere from several days to several weeks after surgery, or it can even happen quite a bit while down the track as well. It's possible to have one large cord or several smaller distinct cords running down the arm. These cords usually start near the site of any scarring in the underarm region. So if you look on these pictures here, you'll see the axillary clearance incision here and how the cords sort of start from there. This cord on this one comes down into the breast and where the breast incision is. And this one, we've got axillary incision here as well with our cords coming up here. Okay. The cords may just be in the axillary area. They might extend down the arm to the elbow. Sometimes they can continue all the way down to the palm of the hand or the top of the hand, and can even sometimes extend down the chest wall as well. So please be aware if you see this or you feel this after your surgery, it is important to know that there's things that can be done to help this. It's not just oh, we'll wait and see what happens or it'll sort itself out, okay? So we're actually unsure what the cause of cording is, which I know sounds very weird. We should know what the cord is, but it is currently believed to be an inflammatory scarring response to the trauma that is caused to the axilla during a sentinel node biopsy or an axillary clearance. It involves both soft tissue and lymphatic vessels. So this to me is really important. Cording can be problematic if it happens before or during radiation. Since this requires to lift your arm up above your head, you need to get this addressed immediately if you are having surgery and then going to radiation pretty quickly afterwards. So you need to just be aware that if you're not having chemotherapy after your surgery and you're having radiation maybe 3, 4, 5 weeks after your surgery, if you've got cording, you need to get it addressed so you're able to feel comfortable in that arm overhead position for your radiation. So don't delay if that is you. Treatment options for cording or axillary web syndrome. So we like to sort of stretch the skin and get that sort of fascia and soft tissue and lymphatic vessels moving in a gentle way. Manual lymphatic drainage massage can be really relieving and help with any congestion that might be there as a result of the cording. We use scar massage sort of techniques on if we feel that that cording is related to the scar, like the photos that you can see there. I have a low-level laser, which I like to use. Some therapists won't have that, but it just helps to reduce inflammation, break up any fibrotic tissue, and just help soften the area. And then, of course, exercises is really important to try to help gently stretch out those cords as well. It can take a few sessions to treat, and it may come back as well. So it is something that some women have all the time, but it's important. You can have cording and not feel it and not have it impact your everyday life, and that's okay. It's when you feel it, when it impacts your everyday life, when it's painful, restricting your movement, we don't want that, and that's not necessary either. Okay. Moving on to lymphedema. Okay, so we can see in this picture that there's lymphedema in this lady's right arm. It is bigger than the left. Okay, so if we talk about the lymphatic system, just very briefly, as I said, I can go into this in a lot more detail, but so the lymphatic system is a network of vessels and nodes throughout the entire body that transport fluid, which is called lymph, from the body's tissues back into the bloodstream. The functions of the lymphatic system are to maintain the volume and concentration of the extracellular fluid, so the fluid that sits around our cells, and to assist the immune system in destroying pathogens and removing waste products from the tissues. So it has a very, very important function. It's kind of the partner to our circulatory system. There are a few things that increase your risk of getting lymphedema. So the risk factors are a sentinel node biopsy can set off lymphedema. The risk is quite low, but it is still there. It's not zero. If you've had a complete axillary clearance, your risk of lymphedema is quite high. So we know that the lymphatic system from that arm will drain to the axilla, and from part of the breast, it drains to that axilla as well. So if we've had all our lymph nodes from there removed, our drainage capacity is going to be severely reduced. So we need to be monitoring that arm as much as we can. Chemotherapy can damage the lymphatic system. Radiation absolutely can scar and damage the lymphatic system. If we have scars or scar tissue in the area, that can block lymphatic flow. Infections can impact the lymphatic system and damage the lymphatic vessels. And if you have a high BMI, so fat, a high amount of fat in an area, again, can block lymphatic flow and impact your risk for getting lymphedema. So some signs to look out for lymphedema is, of course, swelling, like what in the picture you can see there, but it might not be so significant or so noticeable. So it might just be in the hand or a little bit just in the upper arm, and the clothing might just start to feel a little bit tighter on one arm than the other. The arm might feel a bit heavy, okay, or start aching a little bit. There might be some stiffness in the shoulder or in the fingers. Your clothing, as I said, might start to feel tight on one side compared to the other, or rings and jewelry don't fit anymore or digging in. So if you have any of these signs or symptoms, try to get in to see a lymphedema therapist so that they can assess you and make sure that you're not developing lymphedema. So through New South Wales Health, if you're in New South Wales, they have started a surveillance program for breast cancer patients for the lymphedema risk. I'm not sure about other states, but you will have lymphedema therapists in other states who might like to do what we call this prospective surveillance model. This is where we like you to come in, and if they've got one of these SOZO machines, which does a fluid reading, comparing one side of the body to the other, or if worse comes to worse, a handy old tape measure, that we can get some pre-surgery readings done. See what your normal and what your baseline is. We then do that again after your surgery, about 4 to 6 weeks after your surgery. It is normal for that reading and those measurements to come up a little bit. We then will monitor you every 3 months to make sure that you are staying close to within your baseline. And if we can, we will catch any changes early. The sooner we catch these changes, the easier it is to manage. If you are at high risk of lymphedema, so you've had an axillary clearance, chemotherapy, radiation, a big surgery, or multiple surgeries, I really recommend that you probably get measured up for just a simple sleeve and just have it on hand, ready for if you need it. Sometimes sleeves can take a little bit to get in. Sometimes it's difficult to get an appointment. So if you ever get the chance to get a sleeve, I would recommend you take that option. If it's through the public system, usually they're for free. If not, the sleeves are anywhere from $70 to $100, depending on what you need. We can diagnose lymphedema by using the SOZO machine as well, which is this one shown here in the photo. We can be diagnosed conclusively with ICG mapping, which gives real-time footage of the lymphatic system. You will be diagnosed into a few different stages, from 0, which is our subclinical transient lymphedema, which will come and go, which is the most easily managed, all the way up to a stage 4, which we rarely see these days, but can happen if it is left to do its thing and progress. Treatment options, we've got compression is our gold standard. We've then got our manual lymphatic drainage massage, which is a great way to get stubborn fluid moving, or just to give the system a boost if it's feeling like it's a bit sluggish. Exercise, of course, is very important because our muscles are the heart of the lymphatic system, and movement is key for getting our lymph moving. Low-level laser, again, is very good for helping with lymphedema, especially if it's been there for a while. It can help, again, break up some of that fibrotic tissue that's there. Kinesio taping, which is a sort of stretchy sports tape, can be really handy as well to get into tricky areas where we can't get compression. So the top of the arm is a common one because the sleeve will finish and then a bra will finish, and we've got this area that sometimes congestion can happen. Sometimes the hand as well can be a little bit tricky, and kinesio taping can help just lift the skin and help lymphatic flow happen a little bit easier. And then we've got our pumps as well, which are like a big blood pressure cuff, and you pop your arm in there, and that's like your own personal massage therapist, and it just sort of pumps up to a certain pressure and helps get that lymphatic fluid moving. So we have quite a few different options to help people with lymphedema, and what works for you is very individual. So again, I highly recommend you see a lymphedema therapist if you can, especially if you are high risk of developing lymphedema. All right, scars. I love working with scars. I'm quite passionate about making sure scars get the love that they need after surgery. It can make such a big difference to the outcome of your surgery and how confident you feel with your body as well afterwards. So what to expect? So you may have multiple incisions, and how big they are depends on your surgery. So you might have incisions to your breast, to your axilla. You might have scars, little scars left from where your drains were. Okay, so wounds will remain covered with dressings usually until the 2-week mark. And this is where you'll see your surgeon for a review and just to see how everything is going. You may have stitches that might need to be removed, or you might have dissolvable stitches as well. So usually around that 2-week mark, if you have stitches, they should be removed, or they might start wiggling their way out and need to be pulled out as well later on. So as I said, they might be small or they might be quite long. The area around it may be swollen and quite tender to start off with. And so your scabs should form and then fall off around the 2 to 3 week mark post-op. And this is when we can then get into those scars and start treating them to help make sure that they look and feel as good as possible. So looking after your scar, as I said, is important, not just for the look, but for your function. If you have an incision that is this big, quite high and close to your shoulder and your axilla, if that scar is tight, you are going to have trouble moving your arm. Okay, so if we can get that scar nice and healed and looking as good as possible and nice and flexible, you shouldn't have that problem. Tight scars can cause pain. They can also trap fluid as well. So we really need to be giving those scars a good bit of love, especially if you've got some fluid trapped around there. Scars do not need to be noticeable. It is possible to try to avoid hypertrophic and keloid scars, which is where the scar becomes raised or goes beyond where a scar should be, with proper treatment and quick treatment as well. It's important to start, as we said, scar management routine around that 2 to 3 week post-surgery. Okay, our scars and our skin need moisture. So looking into scar oils like your bio oil, there's plenty of other products out there these days. There's plenty of just your normal creams, your silicone gels like your Strataderm. There's plenty of silicone products out there to help keep moisture into that skin. Dry skin is not flexible, and our skin is our barrier. And if we've only got a thin barrier there at our scar, we're going to lose lots of moisture through that scar, keeping it dry. So we want to be putting in as much moisture as possible. And then we can use other products like silicone tape to help trap that moisture in and provide a little bit of a barrier as well. And it also helps flatten scars if they're a bit raised. So silicone tape is really good as well. We can do scar massage, which I'm going to go into on the next slide, which helps with getting that skin flexibility and making sure any of that puckering that can happen where stitches have been tied off, to help make sure that that sits nice and flat. Sensation. So normally we are numb around our scars. How numb, again, depends on the surgery. So we need to be touching that area, massaging that area, looking after that area so we can try to get as much sensation back as possible. And a healthy diet, as well, as we mentioned, is really important in aiding our healing. So making sure we're getting all the right nutrients and hydration so that those scars can have the best chance to heal as good as possible. Okay. So this is how we look at our scar massage. Okay. So we start very light and very gentle. For some people, that's just with your cream or whatever you're using, your oil, and just putting it on, rubbing it in, just for as much as you can tolerate, and then leaving. We can then build up to using specific techniques, like gently trying to stretch the skin, move the skin in all kinds of directions, and doing it a few times per day. So we can do the circular motion, like what is shown here. Okay, circular motion, up and down along the scar, and then side to side. And then I tend to sort of try to stretch along the scar as well. All kinds of directions, just to try to get that skin flexible and used to moving in all kinds of directions. I find a lot of my patients don't feel comfortable touching their scars until I've done it first. So they know what to do and how hard to do it, the techniques to use, and to just know that it's okay to touch that area and you're not just going to, start bleeding or burst or whatever sort of fears that people have about their scars. So if you've got a scar, if it is tight, if it's worrying you, please go find someone who can help you with your scar, whether that's a physio, that might be the lymphoedema therapist. It might be an oncology massage therapist who's trained in scar massage as well. So try to find someone locally who can help you know how to manage your scar. As I mentioned, I didn't write something for that one and that one. Well, isn't that silly? Lucky I know what I'm talking about. Silicone products, as I said, are really good. They help lock in moisture but allow the skin to still breathe. So they are fantastic products and highly recommended to help you with your scars. So again, that might be a silicone gel, it might be a silicone tape. You can get most of these things from the pharmacy these days. So get your hands on a silicone product if you've got a scar. It can be a young scar, it can be an old scar. Silicone products can help with both. Low level laser, as I said, can be helpful if your therapist has access to it. It helps to reduce inflammation. It helps promote healthy cell turnover, improves lymphatic flow and blood flow. It can help reduce pain, and it helps to soften the tissue as well. So I'm a big fan of low level laser and seeing some of the great results that it can have. So hopefully you can find someone locally who has one, because they're great. And then sunscreen as well, as I said, is really, really important. We want to be protecting that skin. So if you are out, and again, breasts aren't usually exposed, but if you do have a scar somewhere else, so maybe like your port scar, okay, if you've got a port scar up here and that's getting exposed, making sure you've got some sunscreen on your scar. You do not want to be burning fresh skin. It won't heal well. It won't like it. So protect your scars if you are out in the sun. Okay, numbness. We're nearly there. All right, numbness is very, very common after surgery. So you might be numb around the area of the incision, okay? This might return. If you've got a big area around your scar, hopefully that will shrink to be maybe just over the scar, but there might always be some reduced sensation over your scar. It is very normal to get upper arm and chest reduced sensation or numbness after breast surgery, or if you've had an axillary clearance done or sentinel node biopsy done. These nerves are very sensitive. They chuck a tantrum very easily. They do not like to be touched. So you might have reduced sensation or no sensation in your armpit and chest, especially if you've had quite a big surgery done. And as I said, it's very common for this upper part of the arm to be numb after your surgery. Again, this might resolve with time. Hopefully it does. But again, it depends on how much trauma has been done as to whether your nerves recover. This process can be a 1 to 2 year healing process. So it's not something that just happens overnight. As nerves heal, they can actually send off quite sharp, random pains here and there, especially in the breast. I find is common for my patients. This can actually be a good sign. It's actually a good thing if we're getting some weird, random, painful signals happening. It actually hopefully means that the nerves are coming back online and that we might get some sensation back. So As I said, numbness might more turn to pain and hypersensitivity, and this is okay. So you might get that nerve pain, which is more like tingling, pins and needles, or sort of sharp, sudden pain, as I said, is common in the breast. Gentle touch is really good to help desensitize and normalize an area. So I really encourage my patients to moisturize the skin of their breast and their arm and their chest area so that we're getting that gentle touch happening and trying to normalize that area. Compression, like our sort of compression bras or a compression sleeve, can help assist in the discomfort of the numbness and pain that can happen. I've found patients get a lot of comfort from having just that support in the area. And of course, exercise can really help as well with our healing and numbness. We want to get those nerves firing, stimulate the area, and try to encourage this nerve regeneration to be happening. Okay, we've got 2 more bits left and then we are done. So shoulder movement. Okay, this is where I'm really passionate as a physiotherapist, is we've got to get your shoulder moving as soon as possible after your surgery. Okay, we want to do small bits regularly. We want to do it to discomfort and not pain. And as I mentioned earlier, it is so important if you are going straight from surgery to radiation to get your shoulder moving as soon as possible. Or if you're returning to work or you've got young children, you don't want to have to be protecting that arm or not able to hang the washing up or continue to not be able to do your hair, whatever it is, for too long after your surgery. We want to get you back and moving and back to normal as soon as we can. So here is just an example of some of my favorite exercises to be doing after surgery. And when I say after surgery, I mean like as soon as you're home. You will be limited if you still have drains in. You are not allowed to lift your arm above your shoulder height if you still have drains in. So just be aware of that. But as soon as your drains are out, you've got to get that arm going as high as you can, as soon as you can. Of course, I mean gently, but we need to be doing these exercises multiple times every day. The shoulder pulley in this picture here is one of my favorite gentle ways to get the shoulder moving after surgery. For shoulder surgery, breast surgery, it's fantastic, a gentle way. It beats the old walk the fingers up the wall exercise by a mile. It is so much more comfortable. And so I find patients are much happier to do it and will do it for a lot longer than they would with walking the fingers up the wall. I then usually get my patients to start with lying down exercises first. So linking those fingers together, raising them up over the head, and then we want to sort of come back over the head using gravity as much as we can and just gently trying to get that down and down as much as we can. And then obviously we want to be locking those hands behind the head, opening up those shoulders and that chest, really giving everything a nice gentle stretch to try to get our movement happening back in the shoulder. These, of course, then progress to more complex stretches and then onto resistance exercise around the 6-week mark after your surgery. So if you're not doing some gentle resistance and you're more than 6 weeks after your surgery, there's no reason why you can't. Of course, in a standard non-complicated recovery, it's important to start building your strength back up around your shoulder joint as much as possible. It's a very complex joint and we want to make sure that we're not having any rotator cuff or shoulder issues in the future. Okay, and the last thing I want to talk about is pain. You will more than likely have pain after your surgery. It might surprise you how much or how little. Pain medication. Okay, the big bad. Take it as needed, especially if your pain is keeping you awake. You need your rest and you need to sleep to heal, okay? You also need your pain under control so you can do the exercises that I just spoke about, okay? It is just a temporary tool to help you get to the next stage, okay? So I know some people are very hesitant about pain medication, and I get it. But it is a necessary tool sometimes in the short term to get you through that first initial part after your surgery. Heat and ice, they are your friends. They are a nice natural way to help with your pain. So we use ice when we are swollen and sore to help relieve pain and help numb the area. We use heat when we've got tight muscles and pain other areas that are near our surgery site, but not quite our surgery site. So we don't want you to ever put heat over your breast or where your surgery was. We use heat if we've got a sore neck, if we've got a sore back, sore shoulders, to help relieve some of the muscle tension that can happen because our posture changes, how we move changes. We might not be sleeping well. So I tend to get a lot of patients with neck and shoulder tightness and pain, and heat is really good there, but never use heat on your breast after your surgery or your chest. Ice for those areas. And then, as I said, massage is your friend, okay? For your back and neck pain that can happen after surgery due to your posture or your sleeping position, massage for tight muscles and sore muscles can give so much relief and so much comfort after surgery. So again, find an oncology physio or an oncology trained massage therapist. They can help you, and they will be your new best friend. You will love them. You will get a lot of comfort and relief from massage as well. Okay. So I just thought I'd give, because I'm not sure where everyone is from. I know I sort of promoted this sort of across most of the states of Australia. So to help you find an oncology trained physiotherapist, you can go to Pink and Steel. They have a find a physio section on their website, which will help you see if you have a Pink and Steel trained physiotherapist in your area. Okay. They might not be in your area, but many of us, because of COVID, are doing telehealth at the moment. So if you can't get to see someone in person, you can use telehealth, okay? If you are after a lymphedema therapist, again, the ALA has the same sort of function. They have a national register of all their registered qualified lymphedema therapists on their website. So again, you can find a local one. Okay. And again, a lot of us can, obviously, a lot of the hands-on stuff can't happen through telehealth, but at least you can get some advice. Maybe we can help you measure up for a garment if you are needing one. So again, if there's not one in your local area, don't dismay. There is other ways, thanks to COVID, that you can access people like myself through telehealth. So I do telehealth. I haven't done a lot of sessions, but I have done a few, and there's still a lot of help that can be given via a telehealth appointment, even if it's just reassurance and education. We can help progress your exercises. Lots of things we can still do via telehealth as well. Okay. I also thought I'd let you know that I've started doing a podcast as well, which is the Positive Health Project podcast. I've done 8 episodes so far. There's a few different topics there. I had a chat with a wonderful lymphedema therapist. So if you want to know more about lymphedema, there's an episode on that. I also went through, again, a very similar presentation to this, which is the episode 8, if you want to have a bit of a refresher after your surgery. So there's a few episodes on there that you might find helpful that you can have a listen to in the car, or pop the AirPods in and have a bit of a listen as you're cleaning the house or lying in your hospital bed after your surgery. So if you're interested, you can check out the podcast, which is available through Spotify and different podcast apps. So through most of them, you should be able to find that. If not, it's there's a website as well, which you can find through my social media pages. Okay, I think that was the last thing I was going to talk about. Okay, so we now have a chance for some Q&A time. If anyone has any questions, please feel free to unmute yourself if you like, or you can pop it just into the chat bar at the top as well if you like. So I'll just give you a few minutes to think about if there's anyone who wants to raise their hand and say anything. Make sure you unmute yourself so I can hear you though. But otherwise, if no one has any questions, please feel free to, if you think of anything down the track, please feel free to send me an email, jump onto my website, go onto my social media for the Positive Health Project. I'm really here to help as much as I can, even if it's not, through a face-to-face appointment. I can help direct you to someone who can, or try to give you as much advice as possible. If you're about to have your surgery, good luck. I hope everything goes well. Please, hopefully you've learned something that helps make this recovery as smooth as possible for you. If you've had your surgery and you're into your recovery, again, plenty of things hopefully you learned from today. Compression bras, yeah, a copy of the presentation. Absolutely, I can do that for you guys. So the compression bras that I spoke to you about, these ones, they're through Haddenham Healthcare. So I don't think they sell directly to the public, but if you get in contact with me, all it is a simple measurement around the top of the chest, and I can order it in for you. Anne, I can definitely send you, talk to you about some details of where to get the compression bra from. I love them. They are fantastic. Definitely worth the money. And yeah, I can send out a copy of the presentation to whoever wants it, so that you've got that there. If there's no other questions, then we can leave it there, because it's been an hour. Please, I hope everyone enjoyed the webinar and found it helpful. If you've got any feedback for me, please feel free to email me or reach out on social media. I really appreciate the feedback, because this is the first one I've done. And if anyone would like any other topics, like as I said, about lymphedema, or anything else a little bit more in depth, please let me know. I'm more than happy to share my knowledge with you guys. So thanks again for spending the last hour with me. Enjoy the rest of your evening, and I will hopefully talk to some of you later. All right. Thanks, guys. Bye.